So this next one's not necessarily a lesson on call that I had, but an interesting question that I had from a friend who I was visiting last weekend, who was asking me what the difference is between an epidural when a patient is getting it for a vaginal delivery or for labor versus when we use an epidural for a C-section. And it really comes down to two main differences. One is the medicine that you're getting through that epidural, and two, it's the rate and the volume that you're getting that medication. So for patients who are laboring with an epidural, usually you'll have bupivacaine plus or minus some sort of opiate, so like fentanyl going through the epidural, and you'll initially get a bolus up front, but then that epidural medication has a continuous infusion going through a pump. Usually it's in a locked up box, and that rate's going somewhere between 6 mLs to 10 mLs an hour. When we have to bring a patient back for a C-section who has an epidural, we do what's called a top-off. And so with a top-off, we come in with syringes and give a bolus through that epidural. And the medication that we're giving you with that bolus is going to be lidocaine as opposed to bupivacaine, which has a faster onset of action. And then we add usually a couple things to it. Usually there's already epinephrine in that lidocaine. That's going to constrict the blood vessels around the epidural, so it lasts a little bit longer. By constricting the blood vessels, you're basically reducing how much of that lidocaine is taken up by the systemic vasculature. And then the other thing that gets added to it is bicarb, which lowers the pH of the lidocaine, which allows it to also have a faster onset, so that if patients are coming in for like a crash or an urgent C-section, their analgesia or their level for the epidural gets achieved quicker, so we can get to surgery quicker. So to summarize, the two main differences between a laboring epidural and a C-section epidural is the medication that you're getting through it, bupivacaine, which is lidocaine, and the rate and the volume that you get. So either a continuous infusion for the laboring epidural or a large top-off bolus for the C-section epidural.